Hello, everyone, and thank you for tuning in to another episode of Legislative Update. I'm here with a special guest. State Senator Jason Lewis will be discussing a series of recent passages. In the meantime, State Senator Jason Lewis, how are you?
I'm doing well. Thanks, Guillermo, for having me on, and it's great to be with you and all of your viewers today.
Well, thank you so much for coming on. Let's jump right into it. And there was a most recent economic development bill that was passed, and with it came a bunch of new exciting provisions. Would you be able to just offer a quick introduction on the economic development bill that I'm referring to?
Yes, absolutely. And let me start by saying that I hope everybody is staying safe and healthy. We're obviously still in the midst of a raging pandemic, and as everyone knows, that pandemic, which is a public health crisis, has also had a devastating impact, on our state's economy. And we've seen so many people losing their jobs or having their hours cut back, and many small businesses, struggling to survive. It's hit our communities very hard. So one of the main, priorities for the state legislature and for Governor Baker, basically for the last year, has been obviously to contain the pandemic as much as we can, and also to try to mitigate the economic impact of the pandemic. So this economic development bill that the legislature passed just within the last few weeks, we'd been working on it for a long time, but the bill finally passed both chambers, and Governor Baker's hopefully going to sign it any day now, is one of a number of actions that we've taken over the last 10 months to try to again to prop up our economy, to make sure there's unemployment insurance benefits for folks who need them, to help provide grants and loans to small businesses, and to help our hospitals, restaurants, and so on. So that's kind of the context. This particular bill is over $600 million of additional investment of state dollars. So this is separate from federal coronavirus relief dollars, which are also enormously helpful to us, to our state. But this is state money, and it's going into a whole host of different programs that support our state's economy. So that involves, support for businesses, particularly small businesses, support for our arts and culture sector, which has been hit very hard, support for gateway cities, support for housing development and transit-oriented development, and a whole host of other economic development programs. Also included in the legislation, because we know how much of a housing crisis we have in the greater Boston area, and this was true even obviously before the pandemic. Housing prices are so high, rents are too high for many people to afford. So what we included in this bill, which is known as housing choice, something also Governor Baker's been pushing for, is we changed the threshold for the local municipal changes to zoning. So I know this gets very kind of esoteric and technical. Most people don't pay a lot of attention to zoning and zoning reforms, but it's very critical when it comes to housing development, because you obviously need to have the appropriate zoning to allow the multifamily housing development to take place. So currently, under current law, it requires a 2/3 vote of the city council in Malden and 2/3 vote of, say, a town meeting in a town in order to change the zoning, to make it easier to build housing. And so that's a very high bar to clear, a 2/3 vote. What this new legislation does, and again, hopefully Governor Baker is going to sign it soon, is it changes it to just a majority vote. So as long as there's a majority of city councilors or town meeting members in a town who support changing that zoning, again, they would debate it, there would be public input, and then they would have to vote, but they would just need a majority vote instead of 2/3 to make those zoning changes. And that many people believe will support what we need to do in this whole region. Obviously, Malden's have built a lot of new housing, so this hasn't really been an issue in Malden. But a lot of other communities, suburban communities, have not done their fair share in building more housing, particularly rental housing and affordable housing. And we think this provision in the Economic Development Bill will help to make that happen. And in some ways, that will take some pressure off cities like Malden, which have felt a lot of the pressure, around new housing development.
So one thing I wanted to note, and thank you for explaining all that, was very helpful. And I want to get a little into the weeds of it, but not too much. As you stated with town meeting or city council, there are new opportunities to allow ease of development in the purpose of building more affordable housing. But I've also noticed that there is some change, not necessarily language, but expanding what could be created at right. Now, the term at right is a zoning development term. My understanding is that it means that a parcel or a property can be built or expanded upon at right, meaning within the parameters where it doesn't need to get brought before the public, doesn't need to get brought before a governing entity. In this case, in towns, it could be like a town meeting or select board. In the case of cities, it's their council and planning board and board of appeals. So in the case of, say, multi-family housing or mixed-use development in an eligible location, my understanding is this is now at right. Is that correct?
So, yep, you did a great job summarizing, because you're right. It does get kind of technical and it gets into zoning policy. But basically, the issue is that, again, going back to what I was saying before, Malden has done, created a lot of new housing, as everyone knows, over the last decade, right? And but that hasn't been the case in some other suburban communities. And there's not been, that much multifamily housing that's been built, right? And so one of the ways we're getting at that is through the change from 2/3 to majority, which I talked about already. And then another way we're trying to get at that is what you're referring to here, which is basically requiring, this new legislation requires that every community that has access to public transit, so either like, subway or commuter rail or bus service, has to have at least one reasonably sized parcel of land that is zoned for multifamily housing. The idea being that, we want to build multifamily housing, which are bigger housing developments near public transportation. That's called, transit-oriented development or smart growth. And so what we're saying is that's where we want that kind of housing to be built. And so we want to also make sure that the communities that have access to public transit, which basically involves all of the communities I represent, Melrose, Wakefield, Winchester, et cetera, in addition to Malden, that there's a parcel of land that has been zoned for multifamily. So that means that developers can come along, they can bring forward a proposal. It still goes through a normal approval process, but they don't need any special permits. They don't have to get any special permits, which often takes time, is complicated. They may not even get the special permits. So that's what by right means. They don't need any special approvals. Just with the existing zoning, they can go ahead and bring forward their proposals for housing. And again, this is part of trying to support and encourage more multifamily housing to be built, and particularly middle income and housing that is affordable for working families, in the greater Boston region.
And one last aspect of this question, thank you so much. That was very helpful. In terms of, I've noticed that they've allowed for an accessory dwelling units to be built at right. My understanding of what that is, and it could be wrong, please clarify, is that I have a house and I want to basically create a property that's abutting part of the house, but it's off of the base of the principal property. So basically maybe creating a studio off of the base of my house. Is that correct? Or roughly in the same?
Yeah, roughly. I mean, it's basically allowing, for, when you, an additional a tenant, if you will, in your home, there are certain requirements around, what what you have to have in terms of size of your lot and your home, and in order to make it a safe habitable space, in terms of, say, bathroom facilities and things like that. So as long as you meet all those criteria, they're sometimes referred to as like in-law apartments, or grandparent apartments, so that's the idea. Again, it's to provide another option for housing. And again, this legislation isn't just saying you can have an accessory dwelling unit wherever you want it, because there are some issues with that, with public health, public safety, traffic, but it does endeavor to make it somewhat more easier and more streamlined to be able to have, accessory dwelling units in our communities, or basically all across Massachusetts. So that's really what the legislation is trying to do. And it's been a, somewhat controversial issue for a long time. So that's one of the reasons that this legislation took a long time to work on and negotiate, because to try to make sure everyone could, generally be on board with this.
So working, not working, even just existing during COVID-19 is difficult. And it's been shown to take a mental toll as long as a physical toll. Last December, it looks as though that the state government passed a major healthcare reform of some nature. Can you expand on that? I saw that there was some resources for mental health, but also resources in telehealth, in mental health, but also in physical health. Can you please expand on that?
Definitely, yes. So obviously we're in a pandemic, it's a public health crisis. And so, this has just really led us to redouble our efforts in Massachusetts to try to make sure that we have, high quality, affordable healthcare for everyone. I personally believe that healthcare should be a human right, that everyone should have access to the care they need, from cradle to grave. It shouldn't rely on, your getting, only having healthcare because you're rich or because your employer provides it to you or whatever. So that's kind of the philosophy that I think many people like me come at this, and that's why Massachusetts has, long been viewed as a leader in healthcare coverage, and why virtually everyone in Massachusetts has health insurance, and we have a great healthcare system. But it's not perfect, and we know it still needs continued improvement. And one of the areas that we've known for some time we need to do better is in making it easier for people to access the care they need. And that's particularly true when it comes to primary care, preventative care, and also mental health, because we have a huge challenge with with access to mental health care. People often have to wait for appointments. Insurance doesn't always cover it. There's a lot of barriers that are. One of the silver linings, that's come out of the pandemic has been the growth in telehealth. And basically, for those who haven't, many people now have taken advantage of it, but basically it means you can essentially see your doctor or a nurse or another healthcare provider virtually, through your computer or even over your phone. And obviously you can't treat everything virtually. In some cases you have to go in person, but there's a lot of things you can do, over a computer. And particularly for basic just wellness checks, preventative health, and for mental health care, for counseling and other mental care, telehealth is really good. So Governor Baker issued an emergency order when the pandemic began to basically allow telehealth. And what this legislation does is, and it's actually based on a bill that I filed because I've been working on telehealth for a number of years. The legislation basically makes it permanent. So even when the pandemic's over, hopefully in the coming months, telehealth will continue to be widely available in Massachusetts. Insurers have to cover it the way they do in person. So from the standpoint of a healthcare provider, it shouldn't really matter. And that means that patients are going to be able to continue to see their doctor, their nurse, their therapist, whomever, if they want to, by telehealth. If they want to go in person, they can do that, but if they want to use telehealth. So that's really convenient for people who have disabilities, who have transportation challenges, who have a hectic schedule, and it works really well, again, for certain kinds of treatment like primary care, preventive care, chronic disease management, and mental health. So that's a big part of what this bill does that we passed in December.
where, despite the passage of this bill, what are gaps in coverage despite this most recent passage? You brought up phenomenal examples about stuff that is not covered. What is still not covered as a result of it?
I mean, everything in Massachusetts for a long time, we've essentially had minimum coverage standards. So pretty much, everything that somebody needs, is covered. The problems you run into are sometimes, how much out-of-pocket cost is still required, in terms of a copay or co-insurance that somebody has to pay, or because a certain provider just doesn't accept health insurance. So even though your health insurer might pay for it, the provider doesn't accept it. That, unfortunately, that happens in mental health quite a bit. Or there's just not enough providers in a certain geographic area, so somebody has to wait 6 months, So those are the kinds of barriers. And that's what we need to do, continue to work on to knock those down. We need to basically make it so that whatever healthcare you need, you can get access to it in your area, either in person or telehealth, quickly, conveniently, and affordably. And that means it can't be, a lot of out-of-pocket cost for you over and above your health insurance premium. So we've come a long way, and particularly in Massachusetts on this, but it's an area we continue to keep working on. I'll give you another example, Guillermo, actually, which is I'm very excited and pleased about. As part of this healthcare bill, we included a requirement for insurers to cover treatment for an illness called PANDAS, and it's also known as PANS or PANDAS. It's a terrible, debilitating condition that affects children. And we're still learning more about it, but it's an awful disease. It affects children, and insurers have not been historically covering all the treatment options for this disease. And so this legislation, actually, one of the other things it does is it requires that all health insurers must cover all medically necessary treatment for PANDAS. So that is actually an example of where there was a gap. And we've now are closing that gap. And that was actually because of my work with a Melrose constituent named Sheila Gausch, who has 2 children, both of whom have suffered from PANDAS. And she reached out to me and former Representative Paul Broder, a couple of years ago about this. And we worked with her and wonderful advocates and colleagues. And I was so excited and pleased that legislation also got included into this healthcare bill.
Thank you so much for answering that. And speaking about health and the nature of it, one thing that you advocated back in 2018 was paid medical and family leave. Now, this is quite exciting in the state of Massachusetts. For those who have heard, once 2021 happened, we got all the notifications. We were told this is now in effect. But if you could explain to me, like I'm 5, or if I'm truly out of state, have no idea about what the paid medical and family leave means for Massachusetts residents. Let's just assume it's me, Guillermo Hamlin, looking to take on paid medical and family leave. How would I, as a constituent or as a resident of the state of Massachusetts, begin to understand what it is and to go about to seek that benefit?
So this is really, really great. I am so proud of Massachusetts that we now have access for workers to paid family leave and paid medical leave. It's really, I think, very sad and distressing that we don't have this nationally in America. Pretty much every other advanced country in the world, Canada, all over Europe, Australia, Japan, they all have paid family and paid medical leave. And what we're referring to is that when somebody, has a birth of a child, or adopts a child, or has a very serious medical condition, say you're going through cancer treatment, it basically means you have the ability to take time off from your job, and 2 things happen. You don't lose your job. Your job's there for you when you come back. And number 2, that you get paid while you're on leave. And it's not your full salary, but you get at least partial payment so that you can still cover your bills. And we don't have this in America. We have a few states that have made great progress in this area. California is one, New York, New Jersey. Anyway, several years ago, I was the chair of the Labor Committee, and Paul Broder, who I was just talking about on the Pandas bill, who was the former rep from Malden, he was the House chair of the Labor Committee. And we worked with the Raise Up Coalition, and we worked with the business community, and it took about a year, but we were able to successfully negotiate, get everybody on board with creating a paid family and paid medical leave program in Massachusetts. So that was signed into law by Governor Baker back in 2018. And that was really, really thrilling when that got done. But what's even more exciting is that it's taken a couple of years now to get the program, fully developed and off the ground. And as of January 1st of this year, just a week or two ago, these benefits are now available to Massachusetts workers. So for the first time in our state's history, every worker, or virtually every worker, will now have access to either paid family leave, that, again, that's on the birth of a child or adoption of a child, or paid medical leave if you have a serious health condition that you need to take time off. So there are eligibility criteria, and there are details, of course, in terms of how much time you can take off and how much of your salary you continue to receive. But all of that is now, available for people to look at. And it's the important thing to remember is that this isn't, tied to a particular employer. So it used to be the case that maybe you were lucky and you worked for a big company that, was providing some paid family benefits to its employees. But, that wasn't true for many workers, and particularly for lower wage workers and the people that we now look at as essential workers. They generally didn't have paid leave benefits, right? So this levels the playing field for all workers, for small businesses as well, because they could not afford to provide these benefits. Now they'll be able to. And it's a state program. So everybody's part of the program. Some employers, if they want to opt out and provide the benefits on their own, if they're at least as generous, they can do that. That was part of the compromise. But otherwise, everybody's in, and it's a state program. It's almost like a Social Security type program for Massachusetts. The way it's paid for is there's a very modest payroll assessment, each pay period, and it's generally roughly about half paid for by the employee and half by the employer. But it depends. Each employer makes that distinction, but it's roughly about half, and it's a pretty modest amount. It's for most workers, it's like a cup of coffee a week to pay their share. And then, when if you're in the situation where you have to take time off work for a week, 2 weeks, a month, whatever the amount is that you need up to a certain maximum, you will then be able to do that. And again, your job's protected, and you still get at least partial pay during that period.
And for small business owners that are like solopreneurs or only have a very small set of employees, let's say it's like, I know that my mom is a hair salon owner. She usually works with herself, but let's just presume she has one employee. Would she be able to benefit from this? Would she be able to close up shop and then just enjoy this for the purposes of medical leave or taking care of her family?
Yes. So we made sure that everybody's part of the state program. So that is including small businesses who otherwise wouldn't be able to have any paid benefits, right, for them, for the owner or for the employees. But what we did say is that we recognize small businesses obviously are, they have, difficulty already just, paying their expenses. And obviously it's been even worse during the pandemic. So we did this program does not require any contributions from small businesses. So when in the case of small businesses with less than 50 workers, they don't actually have to pay any money into the program. So that was a way to try to make this affordable for small businesses. But larger companies, certainly they do have to contribute along with their workers who contribute. And employees of small businesses can still have access to the program so that they can also be still able to take paid time off, if they have either medical reason or for parental leave.
And another question, we were discussing the pandemic earlier, these updates and remote medical access, but how has COVID-19 affected the rollout of paid medical and family leave? Was there any shifts in funding, variations in funding due to fiscal needs that the state needs to take on? And overall, I believe I want to ask also for those who are largely unemployed following COVID-19, how do they fit in all this?
So let me answer those separately. So when the legislation passed in 2018, it did create a new state government agency. It's called DFML, the Department of Family and Medical Leave. And it's within our existing Office of Labor within our state government, but it's a new sort of department within that. So that started to get set up in 2019, and I give a lot of credit to the Baker administration. The state secretary of labor is her name is Rosalind Acosta, and she's done a great job. She and her team are basically creating this new department from scratch. But they've been hard at work on it, in 2019 and then into 2020 last year. So really, they just kept going even through the pandemic, and they didn't really lose a beat. So they put the department together. They created all the rules around the program. They created all the communications materials. They started to build up the trust fund, because obviously the benefits have to be paid from a dedicated trust fund. The same way we have an unemployment insurance trust fund or a social security trust fund. So we created one for this program. And so they created the department, put the program together, got all the rules and requirements. And the trust fund has been accepting money for over a year now, so it's ready to go. So basically the pandemic, fortunately, didn't cause any hiccups in this. And it was always intended to go live, January 1st, with the benefits becoming available to workers. And we hit that deadline. So we were good. In terms of people who are unemployed, it depends. There are eligibility criteria for the program. So you have to have worked for a certain amount of time. It's kind of like with unemployment benefits. There are eligibility criteria in order to get those qualify. So the same thing sort of applies here. So I can't give you a definitive answer because it's on a case-by-case basis. But what I would say, anybody who's watching the show and thinks that this might be something they would need and they might qualify for, they should take a look at the website on mass.gov for Department of Family and Medical Leave. There's lots of good information there, lots of FAQs and all that. Or certainly contact my office. You can contact us by phone or email, Senator Jason Lewis, and we can certainly get you the answers as well and point you to that information.
Thank you so much. And as the state senator said, please look below. Mass.gov will be providing the information here, as well as the contact info for State Senator Jason Lewis's office. Now, the last few bits of questions is education in the state of Massachusetts. Not a difficult one for the state that created public education, but during COVID-19, education has been on the top of lists for parents in having to adapt, work remotely, even administer some schooling to their children remotely. What have we learned this last year with implementing remote, blended, and in-person schooling?
Yeah, it's been really hard, and I am so grateful to our our teachers, our school staff, administrators, and staff, our school nurses, food staff, custodians. It's been really, really challenging, I think, for our schools and for our families and students, of course. Last spring, they had to kind of pivot on it, overnight almost, when we first closed schools and they went remote. That was extraordinarily difficult. We had some more time then over the summer to plan for the new school year, and that was helpful. But but nevertheless, I think it's obviously been very challenging. I think we've managed as best as we can under the circumstances. I do worry, though, that there are certain kinds of students and who've been particularly hurt by this, either remote learning like in Malden or hybrid learning like we have in some other districts, because students certainly with special needs, it's very difficult for them to get their needs met in a remote environment. So I'm very worried about students with special needs and where they're going to be at the end of the pandemic. Also students who come from disadvantaged backgrounds, don't have all the support and resources that more privileged students do. That's been very hard. In many cases, their parents have essential jobs. They can't be at home working at home. They have to leave the home. So, that's been very hard for those families. I know technology gaps. Fortunately, we've been able to provide a lot of resources to help schools, get laptops to students and internet access, but we know that there's still, gaps and disparities in access to, to technology. So that's something we continue to work on. We will get through this, and I think at the end of this pandemic and hopefully the next school year, I think we're going to have to really put a lot of money and time and resources into helping students, particularly those students that have fallen further behind as a result of the pandemic, helping them, to get the support that they need, both academic support, social, emotional support, mental health support, other social services that those students and their families need. That in many cases we had inequities even before the pandemic. That's why we passed the Student Opportunity Act back in 2019. But the pandemic's just made it even worse and exacerbated it. So we've got a lot of work to do. First, we've got to get through this pandemic, obviously get everyone vaccinated as soon as possible, get students back in the classroom, and then we've got to take stock of all the needs. And we're going to have to step up as much as we can to help support those students, their families, and their schools to help them get the services they need.
So Boston 25 Investigates found that hundreds of Massachusetts remote learners have either never logged on or that they're having difficulty logging on. And then in cases of some districts such as Everett, they're working proactively to close that gap of enrollment. How should school districts deal with these needs-based gaps in enrollment? Because naturally, I imagine when I see that there's a need being unmet, causing this truancy, not necessarily the case that they want to have these gaps.
Yeah, you're right. It's a big concern, and I've seen some of the same statistics around numbers of students who are not logging on at all, or maybe logging on only sporadically, and totally agree. It's a big concern. The state Department of Education has put in place sort of minimum requirements for amount of time that students need to be in instruction, either live, online, or in person, or doing independent work. And they've given a lot of guidance to school districts. And there has been a lot of financial aid, to schools, both state money and federal money, hundreds of millions of dollars to try to help schools, provide the technology that students and families need, provide support and training for teachers, to deliver instruction online, to provide money for nurses and social workers, to follow up with families and students who aren't logging in when they should be or getting to school. So there's a lot of effort that's going into it, I know. I agree, though, that it is a concern that we still see, too many students particularly in lower income communities who are falling off the grid. And that's another reason why when we get past the pandemic, again, we're going to have to take stock. And I think for some of these students, we may need extra services over the summer and into the next school year, to help remediate learning loss and other problems and challenges that these families have been facing. They've been dealing with, many cases, food insecurity, potentially risk of losing housing, other challenges, and we need to provide assistance now, of course, which we have been doing as much as possible, but that's going to continue even after the pandemic.
Thank you. And ordinarily, I understand that state and local funding would be able to be the funding mechanism for this, given the amount of money spent ahead of our fiscal years to come to deal with the COVID-19 demand. How how much local and state funding would be needed to address these gaps in the upcoming school year, one would say, as opposed to,
Yeah, I mean, the short answer is we don't know for sure, because we don't fully understand, I think, what all the impacts of COVID have been on our students. We will learn more in the months ahead because there are some plans to do some diagnostic tests and things, in our schools. So we know what sort of learning loss has been like and, better understanding, and we'll take that into consideration into the summer and the next school year. Fortunately, in the CARES Act that the federal government passed back in March last year, and also in the recent legislation that they passed in December, and we're very hopeful that with the new Biden administration, there will be additional relief. That has provided our schools, with a lot of additional dollars. So I think, I'm feeling pretty optimistic that we will have the resources between those federal dollars, between state money that that's available for public schools, and also, of course, the Student Opportunity Act, that we passed in 2019, which also calls for very significant increases in funding particularly for districts that serve large numbers of low-income students and special needs students. So the combination of all of that, I think, I'm less concerned about I think we're going to have the resources. The challenge is, figuring out exactly what we need to do to address those learning losses, the learning gaps, and the other disparities and inequities that so many students and families are facing.
in terms, and this should be roughly the last educator-related question before we go into closing, how would you recommend educators deal with retention moving forward? Would you want to make it the norm to make it, say, blended or remote to deal with retaining students?
I don't know that there's a simple answer. Once everyone's vaccinated, pandemic's largely behind us, I fully expect we will get back to, in-person school for the vast majority of our students, particularly younger students and special needs. But I do think that, we've learned a lot from use of technology, and we've seen how effective it can be. We're using technology right now to do this interview, right? We would have done this in person before the pandemic, but there's a lot to be said for the kind of technology that's available, particularly educational technology for delivering really high quality instruction to students. So I expect we'll see some kind of blended model where we will obviously go back to in person, but let's say a high school student wants to study, Chinese, Mandarin, and let's say the Malden High School, let's say, doesn't offer a Mandarin course, right, or the level that student needs. Then that student could be able to take that course online, and so I think that I imagine there'll be the opportunity to use online learning for supplementing the curriculum for students and for schools. And maybe there will be some students who, for various reasons, aren't able to learn well in person. And maybe then they'll be able to learn it, do distant remote learning at home. And they'll still be able to continue taking their classes and getting their instruction that way. So it might open up those kinds of opportunities that before the pandemic were not really available.
Thank you, and I agree.
We're going to have to figure this out together. I don't think there's anyone really knows how this will all play out, but I'm an optimist, so I do like to think that we will take what we've learned from this pandemic and some positive things and figure out how we can continue to benefit from them even after the pandemic. Just like we talked about, telehealth is a good example as well, that we should continue to benefit from that even after the pandemic is over.
Thank you. And after the pandemic, but before that, we still have to go through the beginning of 2021. What do your constituents have to look forward to in this upcoming legislative session for 2021? Are there any agenda items that you feel really good about, that you feel down the way will be signed by the governor, or do you feel will get out of committee and into the two chambers?
So, yep, we just started a new legislative session on January 6th, so that's always exciting. And I'm very hopeful that it'll be, as productive as the last session was, all the things we've been talking about. Clearly, the next 6 months or so is going to continue to be consumed with the pandemic and continuing to try to contain the virus, make sure we're supporting testing, tracing, getting vaccines out as fast as possible to people, and also just mitigating the continued economic fallout, to support families, individuals, businesses, everyone is hurting. So that'll definitely be the priority for the next 6 months. Beyond that, I think there's obviously we want to continue to work on supporting our economic recovery. We want to continue to address economic inequality, making sure that we have good quality, well-paying jobs in our state with fair benefits. We're going to want to continue to support public transportation and we want to make sure again that we continue to improve the MBTA as people come back to riding again. Housing will continue to be a challenge. We still going to have a problem with how high our rents and housing costs are. So we're going to continue working on that. I'm going to be very focused on also working on childcare and early education. Another thing we've seen during the pandemic, how important it is to have high quality, affordable childcare options for working families. So I'm going to be introducing new legislation in the coming weeks that would help to try to build a universally affordable childcare and early education in Massachusetts. So that's pretty exciting. So stay tuned on that, more details coming, and happy to come back and talk about that. It's the kind of thing that Senator Warren and Congresswoman Clark have been talking about on the national level. We want to bring that to Massachusetts, sooner. So that's going to be a priority for me as well. So we've got a lot of work to do. Continue to work on addressing climate change for sure. But the near future at least is going to be still focused on fighting COVID.
Thank you so much, State Senator Jason Lewis. We will invite you again in a month or two to update on these upcoming bills. Hopefully some that mentioned will have been signed by the governor at that point. I look forward to discussing a few other stuff with you, such as the upcoming seal and flag updates that will be coming. And would love to hear more about the tea on our next episode. But in the meantime, would you tell our guests at home where they could reach you, your office information, and any parting words?
Again, thank you. It's great to be with you, and we should call it UMA now, right? Not MATV anymore.
That's right.
Congrats on the new on the new name and all, and appreciate having this time together and getting a chance to talk about what we've been doing in the legislature. I really encourage anyone to reach out to me in my office anytime if you have questions for us, if you have feedback you want to share with us, if you have a constituent issue you're dealing with, unemployment benefits that you're having a problem with, or your mass health, or anything at all, particularly with if you're dealing with a state agency, reach out to us. We are generally working remotely right now, me and my team. So best thing to do is email us. And that email is jason.lewis, Lewis, at masenate.gov. So maybe we can even put that on the screen. But you can always call us as well. But best is to actually email us, and we will get back to you as quickly as possible. And we also have office hours every 2 weeks. We do that over Zoom, so anybody can come on and talk to me during office hours if you prefer. We want to make it as easy as possible for our constituents to engage with us. Thanks again.
Thank you, State Senator Jason Lewis. This is Guillermo Hamlin with Legislative Update. Thank you.